And we do have new COVID concerns tonight. A new study shows the pandemic is causing a rise in blood pressure in adults.
Yeah, News 12 New Jersey's Marcy Rubin on this story today. She's outside University Hospital in Newark tonight. And why these rates are rising, Marcy?
Yeah, and it's not just a rise, it's a significant increase in blood pressure, more so in women, according to researchers who studied almost 500,000 adults across America, comparing their blood pressure rates between April of 2020 and December of 2020 to the year prior in 2019. And we are finding out that the results are very telling, and the cause, we are told, is our COVID lifestyles.
When you looked at the average blood pressure prior to the pandemic, and then you looked at the blood pressure during the pandemic, there was a statistically significant rise.
Dr. Lois Green spent decades as an ER nurse before getting a doctorate in health administration. She's also on the board of the American Heart Association, where she chairs the Blood Pressure Mission Committee, battling high blood pressure by educating the public well before COVID came into our lives.
Prior to any pandemic, we were trying to educate the community and have people recognize that they can take charge of their health.
This new study out of the Cleveland Clinic showing a significant rise in blood pressure cases during the pandemic is especially concerning, but not necessarily surprising, she says, given the changes in our lifestyle.
Everybody was on lockdown, so people were not accessing their healthcare providers. You know, I think alcohol consumption definitely went up. We ate more. We were more stressed. We need to re-engage with our healthcare providers. We need to know what our blood pressure is. We need to know what a normal blood pressure is.
And she says we need to monitor it regularly. High blood pressure is treatable. If it isn't, it can lead to heart disease and stroke.
We can manage our medication. So if some people have a condition with their blood pressure where it's managed by medication, and if we manage it well, we live well.
Managing that blood pressure, also a better diet, moving more, less alcohol consumption, getting more sleep, being more active, and trying to lower stress in these difficult times, all things to help lower blood pressure. There are no symptoms of high blood pressure, and that is one of the reasons why it is called a silent killer. In Newark, Marcy Rubin, News 12, New Jersey.